Good morning, everyone. Happy Friday.
Hi, same to you.
Nice to see everyone. I hope you don't have too much rain where you are.
Well, I hope everyone is well. There's some kind of nasty bronchial thing going around, and it's impacted a lot of people. So make sure that you're healthy. Be healthy for the holiday season.
Yes.
Emmett, I'll let folks in.
Thank you.
Hi, Emmett.
Hi, Maurice. Hi, everybody.
Hey, Emmett.
How's everybody doing today?
Good.
Just great.
Good.
Better.
Got a nice big group of people joining us today. This is great.
Yes, indeed.
Emmett, God help me. When I was in Spain, I met a wonderful woman in Corvallis, and she is an OSU fan.
Good. Yeah, well, when did you see her? Was it before or after our rivalry game and our head coach leaving to coach Michigan State?
It was before, but she's really into it. And yeah. I thought,
So is Emmett, by the way.
yes, I know. And
It's
so
the end of
I'm
Beaver sports as we know it.
OSU fans.
Just want to congratulate the Huskies for all the money they're going to make in their new conference. I think it'll be really fun for all those student athletes to, get to fly across the country to, play, volleyball or golf against Maryland and all those other schools in the Big Ten. I can't remember how many schools are in the Big Ten now. I know it's more than 10, but
Right. Yeah, Emmett, when I was in the council office a week or so back, I missed you. You weren't there, so we could trash talk the Ducks.
I know.
Don't
I am
there,
glad the
honey.
Huskies won the championship.
I know, I saw it, and my son was watching from Australia. It was really depressing, but they won fair and square. I'm a big Husky fan, so I was happy.
Okay, we still have some folks coming in. Oh, thank you, Emmett.
Hello all, I just finished a week over at the VA hospital to get fully checked out. And guess what? They just sent me home and says you're doing fine. So
wonderful.
That's great news, Bob.
Congratulations.
Glad you have good health. Wonderful.
Yeah.
Yes. Why did it take them a week to figure it out?
I don't know. They fit me up with 2 wheelchairs so I could fit into and get around the house, and they were setting that up for down the road. Not for right now, but I don't know why they gave me 2, maybe one for me and one for my wife. Who knows?
Because 2 are better than 1.
Yeah.
Could do a short conga line.
Yeah, we wheeled together for 55 years, so yeah, tells you something.
There you go. Wonderful.
Good news for you and Sherry,
yes.
Bob.
Good to see you,
Yeah.
Bob.
Emmett, are you checking on committee members?
I am. I know Debbie Lippincott is not going to be able to join us today. She had something come up at the last moment.
What about Aruna and Penny?
Aruna's here.
Aruna just got here. I don't see
she's
Penny.
coming in right now. I haven't seen Penny.
I do see everybody else on the committee, however.
Okay.
Hi, Amy. It's Elliot.
Looks like you're feeling better. Are you?
So far, so good.
There's Aruna. Good.
So, hello. Can you hear me?
We can. Who are you?
I'm Electra Jubon. I am apparently the assigned legislative committee chair for Chapter 13 over in Spokane.
Thank you for joining us. We're excited to have you here.
Well,
Welcome,
yeah,
Alexa.
just remember that I'm new. I'm a newbie to your process. Who is that?
My name's Emmett Mills. I'm RPEC's Government Affairs Coordinator. You'll be hearing my voice a little bit
yeah.
today. And Nancy
I saw
Healy
your
is our,
name in the material.
okay,
Okay, and
excellent.
I'm Nancy Healy, the committee chair. And what was your name again?
Electra Jubon.
Electra Juvan. All right.
Same. Oh, I like that.
Welcome, Electra. It's good to hear your voice.
Can you spell your
Thank you.
name for us?
I got it, Lori.
ELE. Oh, okay.
What did you say? Oh, perfect. All right. I was just going to give her a name instead of a phone number. There we go.
And you said you're from Spokane?
Mm-hmm.
Oh, wonderful.
Indeed.
Do we have anyone else from Spokane?
Yeah, Aruna.
Aruna? And it seems like there's one more. There's 20, we have 24.
Okay. Well, Nancy, I think we have everybody except for Penny here. And it's 10:05, and so I think we can probably get started whenever you feel ready.
Okay, I think we'll call the meeting to order and I will do the roll call. I'd just like to hear your voices. Claire Olivers,
Present.
Ed Rodriguez. See you, we count you. All right. Debbie Lippincott is excused. Dave Kronig.
Here, present.
All right. Aruna Bruda.
Present.
Elliot Weinstein.
Present.
All right. Penny Hall. Still no Penny. Don Boxford
Here.
and Arnetta Henniger.
Here.
Thank you. And then we welcome the pension policy work group members and the healthcare work group members. And Warren Warfield and Matt Grishong will be introducing those members when they give their reports. And also welcome to all of the guests. We love having guests on here. It just helps make the meeting more interesting. We love to have all the input, all the interest. So thank you for coming today. Okay, we're going to start with the land acknowledgement. I'm assuming you all have the packet of information, maybe several versions of it. And I have the land acknowledgement here. I will read that. We acknowledge that we are on the traditional lands of the first people of the state of Washington, past and present. We honor them and their land and are grateful to them for this home. And I appreciate that. Thank you. Okay, and also in your packet, you received the meeting agreements. I don't think we need to read over those, but for those of you that are new, these is the sort of code of conduct that we go by, expectations for how the meetings will proceed and things we've agreed to basically letting everyone have a voice, not monopolizing the conversation, being respectful, addressing issues, not necessarily people. So we appreciate all of you with that. Next order of business is the adoption of the agenda. Can I have a motion to adopt the agenda? And I am talking about the latest version of the agenda that Emmett mailed to us.
So moved.
Second.
Second. Any discussion on the agenda? And all in favor, please say aye.
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 We're going to be
Aye.
sort of a little bit casual on some of these votes. When it's an important issue that's relative, then we can only have the committee members vote, and then we'll ask for a raise of hands. Thank you for that. Also in your packet was a review of the committee meeting, of the committee duties. And that's important that the members read that and are familiar with that. And my understanding is the fact that you agreed to be on this committee means you agreed to the committee duties. And so you may be asked to do some things, especially as legislative day comes up. Appreciate all of you. Okay, next thing is the October 6th meeting minutes. I hope you've all had a chance to read those. Is there a motion to accept those minutes?
So moved.
And do I hear a second?
Second.
Any discussion? All in favor, say aye.
Aye.
Aye, thank you, appreciate that. Okay, we got all of that important stuff out. Now the legislative priorities. This is just a reminder that this is a document that we've worked on in the past, and it's what we believe to be the important priorities for RPEC. And we did make one change to this, and we've been pretty consistent. Our priorities are always to protect the issues for our members. And so that is described on that document. Okay. And now we'll turn it over to Emmett for his legislative interim update.
Nancy, can I just have one question
Yes.
about retirement security piece, another important legislation that I've brought up earlier in the meetings is about Washington Cares or WA Cares Act, which, has begun in 2023, July, and it doesn't affect the current retirees, but it does impact the people who are going to retire. And that, is an important piece of legislation that supporting that would be very useful to retirees.
Yeah, and
from all sectors, public and private.
And I agree that is something that we always support and we're always aware of and we're always following. And as you said, it doesn't affect retirees, but it is important to us. So thank you for bringing that up. We will always keep that on our radar. Okay, Emmett, are you ready?
Yeah, thank you, Nancy. Let's see. So I'm going to start off by talking about the COLA, the Select Committee on Pension Policy and the work that the Select Committee has been doing. So in November, I guess first I'll just give a very brief background on the Plan 1 COLA issue. PERS 1 and TERS 1 retirees are the only retirees, the only retirement systems in Washington State that don't receive annual ongoing COLAs. That's because the state legislature took away the uniform COLA in 2011 to help balance the budget during a recession. We've been working to restore an ongoing COLA for those retirees. What we have succeeded in doing so far is passing bills to enact one-time cost of living adjustments in 2018, 2020, 2022, and earlier this year in 2023. The bill that we passed earlier this year, in addition to giving a one-time 3% increase in July, also directed the Select Committee on Pension Policy to study and recommend an ongoing COLA proposal to the full legislature with the deadline of the end of the next interim for that work. So the end of next year, essentially. So they had this interim to begin working on it. There were other issues on their plate. So that work is going to begin at the December meeting, which happens Tuesday next week. And it's going to be a very initial kind of basic first step, I think, in educating the committee on the issues. We are going to be heavily involved in the process as it continues next year. We expect it to be the main focus of the committee next interim, and they are required to come up with a proposal and recommend it to the legislature. So we are going to be doing everything we can to make sure that it's the best possible proposal for PERS 1 and TERS 1 retirees. So that being said, if the Select Committee, when the Select Committee recommends an ongoing COLA proposal to the legislature, it will be for the legislature to address in the 2025 legislative session. In the meantime, we need to make sure that PERS 1 and TERS 1 retirees receive a cost of living adjustment in 2024. That has been a main focus for us during the interim. And while continuing to remind the legislature that we are expecting an ongoing COLA to be restored in 2025. So thanks to the work of our members, in November, the select committee met and they approved a proposal to the legislature that is a one-time 3% COLA with a dollar limit of $125 per month, which, if approved by the legislature, will come into effect in July of 2024. Every one-time COLA bill that we've passed has had a dollar capped limit. The $125 limit is the highest ever limit that the select committee has signed off on. Last year's bill and the year before that both had $110 per month limits. Over 90% of PERS 1 and TERS 1 retirees will receive the full 3% benefit, and somewhere less than 10% will receive $125 instead. And that, of course, is if the legislature passes the bill. So this is going to be one of our key priorities moving into the next legislative session. The good news is legislators are highly educated on this issue, thanks to all the work that you all have done in meeting with them and bringing them to your chapters. Everybody who we meet with up on the Hill already knows about this issue because they hear about it all the time from their constituents. So keep up the good work. I am optimistic that we can get this through this session. Legislators know that this is important. They know why it's important, but we need to continue to remind them that this needs to get done. And in advocating for this one-time COLA, we need to remind them that, and next year in 2025, we can look at it's going to be time to restore an ongoing COLA. So we're only getting good news on the one-time COLA front. We don't know yet who the sponsor of the bills are going to be. Traditionally, the chair of the Select Committee on Pension Policy is responsible for sponsoring the legislation, being the prime sponsor. The last time that Representative Joe Fitzgibbon, who is the current chair, the last time he was chair was 4 years ago, and he, instead of taking the bill himself, decided to give it to Representative Mari Levitt, who was a member of his party who was going to be facing a tough re-election race, and was somebody who was very interested in serving retirees and invested in supporting retirees in her community. Representative Levitt was the sponsor of the bill and got it passed, and the rest is history. She is now our number one voice in the legislature, and so it will be interesting to see if Representative Fitzgibbon decides to do something similar this year and give the bill to possibly another member of his party who needs a project to work on. So that's something we're watching. He may also choose to sponsor it himself. He's currently the House Democrats majority leader. Another issue that we are watching in the Select Committee on Pension Policy is an issue that has to do with month of death pension payments. Now, under current policy, the Department of Retirement Systems has to prorate the final pension payment that it sends to the families of retirees when the retiree passes away. And so, for instance, if somebody dies on, let's say, the third day of a 30-day month, then their pension payment would only be 10% of what it typically would be, because they were only alive for 3 days. This causes all sorts of issues. First, if a retiree passes away at the end of a month, and the Department of Retirement Systems doesn't find out about it for a few days until, because pension payments are made the last business day of the month. So if somebody dies the last day of the month, DRS doesn't find out about it for a few days, then they have to go and claw back however much they overpaid. So they have to claw the money back from the family, which is not something they want to do, and certainly not something that family members want to have to deal with as they're, dealing with taking care of, the affairs of their deceased loved one. But what's even more concerning is what often happens when somebody passes away. in the very beginning of the month. And if they are a member of the Public Employees Benefits Board, and if they are paying their health insurance premiums by having the premium automatically deducted from their pension, which many people do choose to do that, if the prorated pension amount is inadequate, if it's not enough to cover the health insurance premium, then that person's health insurance is going to lapse in the last month of their life, which is the most expensive, most medically expensive event in anybody's life is probably the end of their life. And so they become uninsured, and family members are stuck paying for hospice care, paying for all the expenses that go into caring for somebody at the end of their life. So that's a huge problem. Department of Retirement Systems recognizes that, as does the Healthcare Authority, because these are the two agencies that see this up close and personal. And so there is a bill that the Select Committee has signed off on that we will be supporting, that would end the Department of Retirement Systems practice of prorating final pension payments. And so that would end clawbacks, and it would also end unpaid PEB premiums for final month of life. So we were excited to see both of those priorities unanimously taken up by the Select Committee on Pension Policy, and we are excited to be working on them next session. I'm going to hand things over to Lori, who's going to talk about the work that we are doing to get ready for the legislative session in the healthcare arena.
Great. Good morning, everybody. So we have quite a bit to share. I will just let you know that the PEB Stakeholders Medicare Coalition continues to meet with HCA. In fact, we have a meeting today, and there's a wide range of topics that we'll be discussing, including passing along some information that has come to me and to other partners about open enrollment and just ways that that process can continue to be improved upon. To that end, if any of you have additional information you'd like to share, please reach out to me and I'll be happy to carry that forward to HCA. I'm going to take us back to last spring. You'll remember last spring that we were successful as a coalition in safeguarding UMP Classic Medicare. So that plan is been preserved. It's within the mix. You had a chance to choose it during open enrollment. We were successful in securing a proviso with the help of June Robinson. And in that proviso, we required the Healthcare Authority to submit a culminating report of the listening sessions that we helped to structure and lead this past spring. That report was due to the legislature last Friday on December 1st. For those of you that joined me on the legislative update call, you'll remember that we were looking for it. We couldn't find it. One of you on the call with me found another report, and I had not seen. Emmett, let's mute folks, please.
Washington's pulling that noise so they can get it cut of the.
I'm okay. I think I got it. Someone who was joining me last week found another report, which I have subsequently shared with the healthcare work group and with Elliot. That report was not brought to our attention, although the work of HCA was referenced in our coalition meeting. So at our request, we asked them to explore options to UMP Classic Medicare. So options that would be benefits equal to or greater than that plan, but at a more affordable rate. And so they contracted with a third party and have been doing that analysis. And the report was just filed on their website. So that's there, but we never did find the listening session culminating report. And then shortly after I was looking, Dave Eisenminger, the director, wrote me and said that the report is still under consideration by the governor's office. So as the state agency, they can't just send things like that directly to the legislature. It has to go first to the governor's office because it's a cabinet level agency. And so that's where the report is now. And as soon as the link is posted, I'll share it out with our members and you will receive copies of that. So, you know, our work continues with them. We have every intention of keeping HCA accountable. They do have an annual retreat that's coming up on February 1st. It is open to the public virtually. And so keep an eye out for that agenda when it's posted, and you can certainly tune in to the topics that relate to Medicare eligible retirees. In terms of a legislative priority, what I want to talk about now, and I took the items out of order, has to do with the PEB Medicare explicit subsidy. So the explicit subsidy is provided to retirees that receive their healthcare benefits from PEB HCA, and it's designed to make the premium a bit more affordable. This last year, we saw all the plans increase in premium costs. And so more of the plans are now eligible for the 183 subsidy. We began meeting with legislators in the spring and summer and through the fall about this issue. We identified a legislator who was willing to carry a bill forward to increase that explicit subsidy. And between the work of that legislator and Mari Levitt's work, there is now a proviso that's being drafted with the help of our lobbyist that will increase that explicit subsidy from 183 to 202. And so we have not seen the proviso language yet, but we anticipate that soon. So that is, it'll be helpful. It'll be an additional monthly amount that will help to offset the premium. And we're delighted that we have legislative champions like Mari and others who saw this as a need. That 183 figure had gone down over the years, and RPEC fought like heck to bring it back up. And it was hovering at that 183 mark for a very long period of time. So we're delighted that they see this as a need. I will share with you that we also, Emmett, Claire, and I met with OFM leaders through the summer months about this issue. And so we've touched all the right bases, and we're excited to see where this might go.
Lori,
Yes,
sorry, it's Nancy. That proviso, does that become part of the budget, or is that a bill?
it does. It does. So that we originally pursued a policy bill, and then through further discussions that our lobbyist was involved in, it transitioned into a proviso. And that happens sometimes. That's what happened with our bill around preserving UMP Classic Medicare last year. It transitioned from a bill after going through committee and became a proviso that was carried by June Robinson. So that's very common. If this is the best path forward, great. We don't care as long as we're successful with it. And we will be supporting this through our advocacy efforts. And we also will have background about the explicit subsidy and with the bill language for our advocacy work together on Legislative Day, which is January 22nd.
Lori,
Yes.
this is Luna. Would that go in effect January 2025?
We don't know. We hope so. We haven't seen the language yet, but
Okay.
we were urging an immediate increase, and so we're hoping so. Good question.
Lori, how can we help? I mean, obviously the budget hearings, they go on forever and everybody it's like a trash can. Everybody talks about everything.
Yeah, well, we'll start the advocacy on that right away. We're anxious to see the proviso language, and I hope that we'll have it by month's end. And so we'll be carrying it as one of our messages in Legislative Day. And as we meet with legislators, this is so important for all of you because you're touching your legislators who represent you in the state legislature. As you meet with them, you need to keep this on the front burner so that when it comes to voting time, that they vote in favor of this. And you're right, the day that we will testify on this, it's a cattle call. You wait all day to testify for 1 minute, and there are hundreds of people who are testifying. And so what we want to do is lay all the groundwork for that well in advance. And we will do that, just as we've done in the past with provisos that have supported our legislative priorities. But this isn't something, to Elliot's point, you don't do this when they do the final budget hearings. You lay the foundation with all the legislators who were in the state legislature so that they understand that we want this to pass. And so then the testimony that you give with all the other hundreds of people, it's almost just checking a final box, if that makes sense. We will have done all the groundwork.
So this will be one of the items that we have legislative day talking points, and we'll have it spelled out with the other priorities.
Right, but we haven't seen it yet. But there's support for this, and since Mari was mentioned earlier by Emmett, she, Carol, and her members met with her, and she's all in on RPEC. She is our most cherished champion, and she immediately went to the leaders of appropriations and started discussions with them. And so that was taking place at the same time we were starting to work on a bill. And so this all came together very nicely, and we're excited to see what the language will look like. Aruna, did you have another question?
Yeah. So the education of the legislatures would be important, all the legislatures. So when the vote goes for the floor vote, as well as in the committees, that we have an impact, right?
Yes.
Okay. So do they know about the issue at all? Or how much preparation as we talk to our legislature, we need to do the background work?
That's a good question. It's going to vary based on how long they've been around and what committees that they serve on, right? But I would suggest that we provide them, and it'll be in the one pager, the background about what this is and why it's important and how it provides financial relief. We've got a good case to make because all of the plans are going up. And so even though this is just about a $19 increase, it still will be helpful at a time when premiums are skyrocketing for all the plans. By then, we'll also have some additional information about open enrollment. I've seen some preliminary information on that, and I know Elliot probably knows it far better than I am. I do. I've looked at it, and there's been movement within the plans. We expected some movement with UMP because of its huge increase, but there was huge movement in Kaiser. And so their premium's gone up too. And so I think we've got some good data to share. We are going to have to start and educate people. We shouldn't assume a level of understanding with anyone. But I can tell you, if they're serving on a healthcare committee, and Emmett and I took a meeting with a legislator, and they know what this is because they're on healthcare. But it's not gonna, that won't be the case for someone who is, on one of the other committees and may have had no experience with this. So you'll have that in your talking points for January, and we're just going to have to keep a steady drumbeat on this through the end of the legislative session. This session is going to be really fast. And so I know you all know that, but it really is it's like drinking out of a fire hose. Bills are going to be hearings are going to start immediately. And so if we reach out to you and ask for your help, we may not have much consideration of time. So please do not be upset with us. We are, it's really fast moving, and we may not have a lot of time. We may contact you and say, would you submit your story, and we can help you get that submitted as written testimony. But you may only have a day or two notice, because that's as soon as we find out that it's been scheduled for a hearing. So just be aware. That won't pertain to this per se, but it's on any other bill that we happen to be following, or the bill that Emmett has just spoken to. So
Elliot has her hand up.
Yeah. Another good thing about Lobby Day is you have other people there who have dealt with that legislator before. And so someone in your group that you meet that morning can say, oh, I've dealt with her. These are her hot spots, or this is what he gets excited about. One thing I've been happily surprised about is healthcare and pensions tend to be a bipartisan issue. As Lori has mentioned, as long as these people vote on our issues, we're supportive of them. And legislators that I've been in knockdown dragouts with over other issues have, when we've walked in, they've been, oh, hi. And I've been like, is this the same guy I spoke to last year? Holy God, who is this? But they, on these issues, it's bipartisan. So that is reassuring. And there will be other people in the legislative lobby day that will be supportive and can help you with some of these legislators. You won't be left on your own. Okay, I'm done.
Thanks, Elliot.
Carol has her hand up.
Thank you. I believe, aren't the legislators all on the PEB plans as well? Aren't they experiencing the same premium increases we are? I know Conway is in Kaiser.
I don't know. Elliot, you're better poised to answer this. I heard through the grapevine that at least for like with WFC, that some of their premiums for actives went down. So the increases were for those who are on the Medicare related plans.
Right.
So they may be under a different type of coverage managed by PEB. And I'm ignorant about that, but they are, yes, they get their benefits from PEB. I just don't think that it's the same benefit that our Medicare eligible retirees receive.
I wondered because when I spoke with Senator Conway, he was complaining about the favorite drug list and all the hoops he had to go through to get the medication he needed. And I assumed from our conversation that he was being affected by the same premium increases and the same rules that we were, but I'm not sure.
Yeah, and I don't know how it works with legislators because he's in his late 70s. So I don't know how it works with them. I mean, honestly, I just care about all of you, but it's a good question. And after we take Matt's, I wanted to speak to something very quickly. I want to go back to something. Matt?
Yeah, just quickly, I believe Elliot can correct me, but I think that for active employees, Kaiser went up like 43%. Kaiser's in a world of hurt. And I think there was a lot of movement away from them because of that.
Well, I was looking at the retiree area, and I think thinking back through the information I heard from the listening sessions, I think folks are frustrated with Kaiser because it's difficult sometimes to meet with your primary care physician. Some people complain that it's been like a year every time they go and they meet with someone else. The other complaint that it stands out for me is that people were frustrated with the way they changed their pharmacy benefits. And it had to do with mail-in. It also had to do with a flat fee for certain medications. And, you can get penicillin for 25 cents or 30 cents. And yet people were paying a flat fee of, I'm making this up, $5 or something. And so there were some issues that came out in the listening sessions around their pharmacy benefits. So I'll be interested. We meet with HCA today, and I suspect we'll be talking a lot about open enrollment and what they've seen. And that's why I said, if you have things you want to share with me, I got some good input about how confusing the forms are, and they were supposed to improve the forms. So if you have feedback, do pass that along. And Nancy, do you want me to talk really quickly about the letter that we did for the governor and for HCA?
Yes,
So based on meetings that we had with HCA back in, I don't know what it was, could have been September, the PEB Stakeholders Medicare Coalition that we lead, we generated a letter that went to the governor's office and to Sue Birch, who heads the HCA. So the letter was generated because the governor's office had heard through the grapevine that we had some concerns about proposals that were under development by HCA. And although I tried to set up a meeting with coalition partners and the person on the governor's staff who deals with healthcare issues, that meeting never materialized. So we decided to put in writing the concerns. So the concern is essentially this. We asked HCA to look into affordable options that had benefits that were greater to or equal to or greater than UMP Classic Medicare. But we did so, but we don't want them to eliminate the plan as it stands now. There was lots of feedback in the listening sessions about how extraordinary this plan is and all the reasons why it needs to remain in the mix. And so the feedback that we had received informally from Dave Eisenmenger was that, these two plans can't be provided at the same time. It would probably become it probably would be this more affordable option. That's kind of what we were led to believe as we were listening in and meeting with HCA. And so our letter just expressed concern that, please do continue to explore options, but don't eliminate this plan. Don't force retirees to make a choice between one of these two until you know that it is in fact equal to or greater than. And HCA up until now, and this is still the case, they're not sure that all of the pharmacy benefits will map directly the same. And, we know that that's a concern for all of you. When your doctor prescribes you with a specific medication, and Carol just spoke to this even with Senator Conway, you want to have access to that medication. And, you want to make sure that you don't have extraordinary out-of-pocket costs. And so until they can satisfy some of those questions, we are not enthusiastic about them leaning in this direction, right? So that's, the main topic that was stressed in our letter. The other is about this Medicare explicit subsidy, that costs keep going up. It's affecting retirees on many different plans, and we need to look at the explicit subsidy and increase it to provide relief. So those were the two main things that were within our letter. And Sue Birch wrote a very detailed response that came last Friday, and I'm crafting a response to her that is going out today. And it's very brief, just by email, acknowledging her letter and thanking her for the thorough explanation. I'm glad to hear that she has reaffirmed that UMP Classic Medicare is still going to be offered in the mix, and there's no plan to remove it. And so I'm eager to hear where they're going with these other options and if they have more information to share. So if we had opportunity to meet with the governor's staff, then this letter probably would not have been generated. But I'm glad that we did. We have an obligation to share concerns with Sue Birch and where appropriate with the governor's staff. And so that's kind of where we are on this. And I'm glad to hear that UMP is going to be in the mix moving forward, and we'll see what they do with these other options that might be coming forward after the retreat on February 1st. Okay, this has taken up a lot of time on the agenda, and I'm so sorry, but I'm going to go on mute and I'll let Nancy proceed. Thank you.
Okay, Emmett, were you going to address the next issue?
Yeah, I'd be happy to do that. Thank you, Nancy. We received contact from the organization Healthcare for All Washington. They gave us two proposals that they are looking to have introduced as budget provisos next session. They wanted us to have an opportunity to review them and provide feedback as those proposals are being drafted. One of the proposals had to do with expanding benefits for low-income Medicare beneficiaries. This is something that we didn't find to be especially controversial for us. It would essentially expand benefits for low-income folks on Medicare, which is great. The other proposal proposed combining PEB and SEB active employees into a unified purchasing system. PEB Medicare retirees would not be included in this in part of the consolidation. And so the reason that this organization is interested in doing this is because I believe they see it as a path forward toward having a single payer system in Washington State for health insurance, and a combined PEB and SEB could potentially be a vehicle for that. We had concerns about the way that the study was at least proposed. And just to clarify, we did not see any actual legislation on this. We saw one-pagers that this organization has put together. So we don't know what the actual language says. It's currently being drafted. But if PEB and SEB were to be combined into a unified purchasing system, but PEB Medicare recipients would not be included in that, we would like to have clarity on how the governance structure of PEB and SEB would change. And it's essential that retirees continue to have representation on the PEB board. So that is the feedback that we provided, and you can see our response in regard to those proposals that we were shown. It's really important that we continue to, have Elliot, who is our voice for retired public employees, be able to serve on PEB, that retirees continue to have somebody who can speak for them and advocate for high quality health insurance at affordable premiums. So that's what happened with those healthcare for all proposals. Lori, would you like to speak to the Fair Health Price Campaign communications that we recently received? And this is going to be in the second packet, the supplemental packet that was first shared with the committee yesterday. Lori?
I don't have it handy. If you can give me just a minute, maybe
Yeah.
we can come back to it.
Okay, while Lori's doing that, I did skip an agenda item 8A, a fiscal update. So I'll go back and I will quickly provide some information on that. So the fiscal update that I believe came out in November had revenue down a little bit lower than what was anticipated, down about, let's see here. We have revenue down about 2.2% lower than forecasted than it was forecasted to be in September. That is not a huge change, but as we head into this short session, we need to remember that it is it's not an operating budget year. It's a supplemental budget year, and so the legislature is going to be making small changes to the budget based on the funds that are available. So and what funds are available is mostly determined by how much revenue is coming in. So it's a little bit lower than what is coming in at the moment, than what was anticipated to come in. And we can keep moving on here. Would you like us to come back to that agenda?
No, I'm
item
fine.
later?
I'm
Okay.
fine. Thank you. I
Yeah,
just have
please
to,
go
I
ahead.
had to pull it up.
Okay.
So we were approached a few days ago to sign on to a letter that deals with a rulemaking provision called charity care. Excuse me. And so this charity care rulemaking is under the authority of the Department of Health. So the letter, and I'll just read it. We urge you, this is a letter that's going to the the right folks. We urge you to hold hospitals accountable and to continue the rulemaking to incorporate the changes made by the legislature. And they've given the citation for the bills. Essentially what hospitals are doing is they're not telling patients who would qualify for this charity care. And so this means that those who were low income, that it reduces their costs for hospitalization. I'm just kind of reading through this letter real quick. So hospitals are violating the charity care notice requirements by not sharing this information with patients who might be eligible. So in other words, patients who are low income are not aware that they would qualify for either free or reduced care. And so they end up with stacks of hospital bills and extraordinary medical debt. So they said that it's estimated that 5% of the state's population, or 400,000 people, are being hounded by debt collectors because of these medical bills, and that they would otherwise be eligible for this provision. Looking through this, we stand with organizations that are striving to improve healthcare affordability. Many of our partners have already signed on to this letter. The way our governance works is when the committee isn't meeting, typically we'll touch base with Nancy and the president, with Claire Olivers, and we'll take a look at the legislative priorities. They exist so that we can respond in a prompt manner to opportunities like this. But with the committee meeting today, it just was very timely because we don't have, our deadline to sign on is actually by the end of today. And so this was before the committee for your consideration. The materials, we passed on the materials we received. We are part of this coalition. We joined it last year to support their efforts around the Medicare cliff. So we've been urged to sign on by Gwen Wrench, who represents us on healthcare as a human right. But we also are members of this coalition and have been involved in other healthcare affordability initiatives that they have led. I think Ed's hand was up first.
Thank you. The point is that the hospitals are required to inform about charity care to all patients, whether they're poor or rich. And because they skip it, for some, they might push a lot further, and that way you're not committed. And then people end up in debt, and the debt goes to debt collectors, and the debt collectors, I didn't know this, but they're supposed to make a lot of profit, up to 50% of the debt. So people just get stuck with this thing. It's just like indentured servitude used to be, and you can never break the cycle. So
well, we all know what the red tape looks like, right, Ed? I mean, I mean, some of you have been stuck in red tape relating to PEB, and so you know how frustrating it can be. And it's hard to get people to help you navigate when there's a problem. So this is really tragic. It's especially tragic for people who are non-English speaking. And so, this is impacting disproportionately people of color and our Washingtonians who are non-English speaking, and so, or limited English speaking. I think Elliot was next, and then Aruna.
Lori, correct me if I say something wrong, okay? The good thing about siding with the coalition on this is that I was exposed to the coalition, a facet of the coalition that Lori has signed us up with. They also have stood in the streets protesting over the privatization of the New York City workers who were going to have their what's the word, shuttled off into Medicare Advantage, and they raised holy hell. And I connected with them, and they said, your president is already connected with us. Why are you calling us? She's in this coalition. Go through her. So, and Lori knew all about it. So, it is really good for us to stand with these people because Oregon also has a very active chapter. And we can always team up with them to get pointers. So if we support what they're doing, it really helps with our solidarity. The unions for state employees have really stepped up, and for city employees. I didn't realize they were screaming in the streets and almost, they formed picket lines in front of City Hall in New York City. They were that activist. So they know who Lori is, and they told me, go through Lori. So I think her idea is a really good one. It'll show our solidarity with the other chapters. Lori, correct me if I'm wrong.
Well, I guess the honest answer is I think this is a different group because the Fair Health Price campaign that has urged us to sign on, I believe that they are only Washington based, but there is the other organization that Elliot referred to. We are connected with them. I have spoken to their leaders, and they interviewed me last year on something. They're remarkable, and we've thought about maybe having some of the senior advocates who were involved, having them speak to our members just because they're inspiring. I mean, they were tenacious, and they stopped something that would have been detrimental. So, and we've been in a similar fight, and that's why they stand with us. So Elliot, you may have information that I don't have. I just know that with this Fair Health Price campaign, and I'm happy to pass on something that they shared with me. I'm meeting with them in a couple of weeks just to give them an update on our work with the Medicare explicit subsidy and to ask their help in that manner. They will sign on pro. So one of the benefits of being in groups like this, irrespective of the group we're talking about, we have commonality. And what happens when it comes to bills, we work behind the scenes and we have them sign on. And so, I'm going to give you an example that's not related to healthcare, but it's related to our work with the COLA. There was a bill, there was a letter submitted that didn't have RPEC's name on it. But we worked behind the scenes to have the leaders of every major union that we work with sign the document. So, AFT Washington signed, WFC, Council 2, Teamsters, our members come from those union groups, and they submitted a letter. And so they are a coalition of support around that particular topic. And we have many others. Elliot's referred to one group that stands with us, and they're more nationwide. And then we have, I think the Fair Health Price group is just for Washington. We don't want to join. We want to join groups like this when it makes the most sense and when we do have true alignment. So please don't walk away with the idea that we're joining all of these coalitions. We're not. We're very selective on who we are partnering with. But with this particular group, we partnered with them last year around their work. So some of you are familiar with NOLA, and they do a lot of work around healthcare affordability, healthcare access. Healthcare is a human right as part of this group.
So do we need a motion from this committee?
We
to
would.
support this Fair Health Price campaign?
And as I said, just so all of you know, one of the reasons we have the legislative priorities is sometimes we don't have the luxury of waiting till we have a legislative committee meeting and we've been asked to participate in something or an opportunity presents itself. The legislative priorities document is the test. We take the opportunity and we compare it against our legislative priorities and say, is this complementary? Can we support this? Is this consistent with our own platform? And that decision is rendered by Nancy as our chair and by Claire as our president when this body, when all of you were not meeting. So I just want to explain that because I think there was some misunderstanding in the last meeting. Not everything can go to the legislative committee because of a timing. You don't meet every couple of weeks or every month. And sometimes we don't want these opportunities to slip through our fingertips. It worked out this time so that you could actually make a motion and you can support this if you choose to. So anyway, yes.
May I make one last point? The other good thing about this proposal, HCA administers, I believe, has something to do with the administration of this program that is under consideration. And it might not be bad to be in tune with or support something HCA is doing in another unit. I'm just saying it helps our record. It's like, no, we're not against you on everything. We support what you're doing for poor people. We applaud you, even though that kind of sticks in my throat. But, you know, I think it can't hurt.
Yeah, thank you.
Okay, Aruna.
Thank you. I was wondering, you know, we work very hard on passing the legislation that helps affordability, accessibility and affordability of healthcare. But rulemaking is another part, you know, where we need to pay some attention to, and that this group has, you know, brought. I'm totally in support of it, and I make a motion that we support healthcare is a human rights organization's proposal, you know, for holding the hospitals accountable for charity care.
So you're
But-
talking about this fair health price campaign and the charity care issue.
Fair health price campaign. Okay, I thought it was HCHR, but if it is fair price.
All right. Is there a second for Aruna's motion?
I second, and I'd be happy to cover the rule hearings. I used to write rules for 3
Right.
different state agencies.
Any other discussion on this issue? Amy?
Yes, I would like to also support this. A suggestion is that possibly the healthcare group could look at some of these related organizations and identify them and their positions that might be able to help in the interim time when the committees aren't able to meet. And then there would be some guidance for some of these decisions that require a faster turnaround. Both the Department of Health and the Healthcare Authority have various health activities going on and healthcare activities for equity and other elements that may be of interest to us and also to the coalition. And there's a large number that are hard to grasp. And if they just come out of the woodwork and want a quick response, perhaps we can have done some research or investigation to make sure that we're aligned with our legislative priorities for this and feel supported.
Thank you. Okay, so we have a motion to support the Fair Health Price campaign, supporting this charity care issue. So all the members, please raise your hand if you're in support. If we can find that. I see 1, 2, 3, 4, 5, 6. That should do it. Thank you. The motion passes. All those against? Abstain? I think we're good. Thank you. Thank you, Lori, for that. Are we finished up that issue? Are we ready to go on to federal update? I just want to backtrack for one moment when Emma talked about month of death. Did anyone have any questions about that or any concerns? I think we're good to go. Okay, Emmett, are you there?
I am. Thank you, Nancy. So I'm going to talk about the government funding status. So the federal government is funded through, let's see, January 19th and February 2nd. There's 2 dates that different types of appropriations are funded through. Congress has passed a few different short-term continuing resolutions, but there are still we've yet to, I guess, achieve long-term resolution as far as how the federal government is funding, and there is a little bit of turmoil still in the House. So that conflict has been kicked down the road, and we will continue to monitor the issue and continue to advocate for full funding of the federal government and no cuts to services that are and programs that our members rely heavily on. And that will continue to be an issue at least through the beginning of February, it looks like. Next on the agenda here, Lori, would you like to speak to the prescription drug subsidy for government self-insured plans issue?
I am happy to.
Thank you.
Of course, we've got two experts on the call, Elliot and Carol, as well as Bev Hermanson, have all been involved with this as well. So, gosh, it was probably spring, sometime in spring, late spring, we sent a letter to members of the Washington State delegation expressing the need for their help to extend the federal subsidies that are afforded to Medicare Advantage plans to government self-insured plans like UMP Classic Medicare, with the aim of improving the premiums because of their skyrocketing cost of that particular plan. We did follow-up. We did a very successful meeting with Patty Murray's state director, and it never went anywhere after lots and lots of emails and phone calls, but we had a good meeting with him. And then we set up meetings with the healthcare policy legislative assistants for other members of our congressional delegation, and Nancy Healy and Claire Olivers and Derek Van Spoor met with them in person in September. Those meetings were productive. It became pretty clear that there needs to be an act of Congress to make this change. And so we're pursuing not only the extension of these subsidies to plans like UMP Classic Medicare, but also we are advocating for the expansion of Medicare benefits to include vision, dental, and hearing. So the meetings that Claire, Nancy, and Derek took in very late September, we've been doing follow-up on those meetings. And at this point, we're trying to see if Marilyn Strickland would be willing to carry a letter. Her legislative person said that there might be interest in doing that. And so we're hoping that that will come to fruition in the new year. So one of the, I guess, frustrations in working at a federal level is that things just move a lot more slowly. And so I know this sounds like a really long timeline, but that's the way the federal government works. The check and balances are there for a reason, and they have a lot of issues that they're dealing with. And right now we have there's not a lot of purposeful work that's being done in Congress that relates to there are threats to the areas that we prioritize, but there isn't purposeful, proactive work like this. And so that doesn't mean we give up on it. You may hear kind of a similar report when we meet again. We're trying to get this going, but have we followed up? Yes. And so we're trying to see if she will follow through with a letter. Aruna?
Representative Congressman Ro Khanna has introduced the bill, on preventing the privatization. And if we can have any of our representatives or congressmen or women to support it, that'll be really good. And secondly, hearing, vision, and dental is really important, but also the preventive health in terms of gym membership also, if that can be included in original Medicare, I would really advocate for it, because many a times that, prevents a lot of heartache and the expenses for the individual enrollees as well as for the government. So if that makes sense to everybody, I would like to add gym membership in support of that. In
Yeah.
addition to those three other important areas for parity between original Medicare and Medicare Advantage.
Elliot may want to speak to this. Expanding any benefit to Medicare is not a popular agenda item. When there's constant threat to Medicare funding. And so I will just share that I know this came out in our listening sessions as well. And we would all agree that this is an important benefit. It's not lost on me that you've shared this, but I will tell you that some of the groups that we advocate with, they prioritize these other items that they view as being more essential to quality care and health. And some of these things are very high cost also, especially dental and especially hearing. So, Elliot?
I guess it depends how you, this sounds very lawyerish, but it depends how you negotiate with the, gym membership. You can use it as a bargaining chip and say, we'll drop the gym membership if you see where I'm going with that, if
I
you
do.
agree to the other three. But I kind of sound like Lori's little acolyte, but I guess I am. Lori's right about that. The three other areas have been traditionally lobbied for years. So there's a history here of trying to get those three passed. And the other thing is you have a lot of the medical communities, and especially the communities that, the providers of those benefits lobbying for this. So who have an auxiliary medical background. So you've got them as well. And so you've got that push behind you. So I could see introducing gym membership kind of as a loss leader, and then you're willing to give it up. But really, it would be up to, Lori would be talking to our legislators, and the legislators could decide how to use that argument.
Yeah.
Okay,
I think that's
I'm
a good
done.
point. Both of you have made great points. I agree.
Carol?
Thank you, Nancy. I just have a quick question. In your outreach to our legislators, our Washington delegation, is Kim Schreier one of the people that you reached out to?
Yes, and also Claire, Nancy, and Derek met with her healthcare policy person when they were in DC.
Good, thank you.
Yeah, with her medical background, you would think that she'd be all over this. Yes, thank you, Carol. And I'm bummed that we're not going to have Kilmer continuing, because you've built such strong rapport with him. But this is the nature of what we do. We're constantly building relationships with the newly elected, and so we'll have that chance in that congressional district.
So I have a question about that district, if it's all right to ask it now.
Go ahead.
So Emily Randall emailed yesterday that she's running for the 6th district spot. And I don't know, I believe, isn't that the same Emily Randall that supported our women veterans request to have June 12th as an annual celebration of women veterans? Is that the same person?
Mm-hmm. It
So,
is.
and do we know who else is running for that spot?
Hillary Frank is also running for that, I think.
That's what I'd heard.
Hillary Franz.
Yeah,
Okay.
because she's pulled out of the gubernatorial race.
Well, thank you. Yeah, I was concerned about that because she wanted a donation and she supported us. So on a personal level, I might support her just for that reason. Thank you.
Thank you.
Ed,
I think we need to ask ourselves why all these offerings of gym memberships and even chess, paying for dues and organizations that promote chess are being offered under this advantage care. I think it's like the proverbial straw that breaks a camel's back, and that'd be Medicare, because they draw attention, interest, but it's not totally necessary. Medicare now requires a yearly health check. I mean, they're looking into possibilities of maintaining health by actually doing the hard work, the lab work and all of that. So gym membership is nice, but all you need to do is get a book in the library and follow a program and do it yourself. And so, okay, socialization is added to it, but I think, why are they doing it? And I think it's just a distraction. And it's just to offer something that really is like smoke. It doesn't have substance to it.
Thank you.
At least in my mind. Thank you.
Appreciate your comments. Okay. Lori, are we finished with this and ready to go on to the debt commission?
We are. I can cover it very quickly.
Okay.
And so in the monthly letter that you receive from me, and it will also be in the news flash that comes out today, we are keeping our eye on a piece of bipartisan legislation that was introduced both in the House and in the Senate. And I will just share with you that the Alliance for Retired Americans and also AFSCME retirees are keeping a close watch on these bills. The new speaker, Johnson, has been a very vocal advocate for a debt commission, which on paper is supposed to create basically a plan to improve the nation's fiscal trajectory and to lower our debt. Our retiree organizations are concerned, rightly so, that this is another opportunity to slash funding for Social Security and for Medicare. And so in the communication that you have already received from me, if you're reading your newsletters and our presidents who are on this call today, you have those links as well. I'm sure you've shared them out by email with your members. You'll also be able to read a white paper that the Alliance has put together on this matter. We're keeping this on our radar. We're also waiting for direction from AFSCME about how they would like us to respond, because we want to always try to work in sync with our national union. But I just wanted you to be aware of this, and we may be asking you to respond to a call to action in the new year around the formation of this debt commission. And it would be to preserve funding, of course, to Social Security and Medicare, because these types of commissions tend to go after what they call entitlement programs. And so there's justifiable concern.
Thank you. That is important that we keep our eye on it. Okay, now we move on to Legislative Day, and I'd like to talk to the committee members. I'd like to get your assistance in getting people registered. I checked with Derek this morning, and we have 60 people registered for Legislative Day. Last year, we had 130 that signed up. It's still early days, but I'm just going to ask each one of you to contact people in your chapter, in your district, and remind them if they haven't filled out the form yet to get registered, because that's the reason we're here, Legislative Day, to talk to our legislators about our issues. It's really important that we get as many people as involved as we can. And you all know they love to hear from their constituents rather than, just someone that shows up at their office with a list of priorities. So please, I'm asking each one of you to make that a mission to contact the people you know in your chapter to get them registered. The other thing is Alyssa is going to need help putting the packets together for Ledge Day, and that would be on January 18th here in Olympia. That's a Thursday. If you would contact Alyssa and let her know if you can be available to do that, or turn your name in to me. She'll be giving you the exact time and instructions for that. I think we need 2 or 3 people up there just to make that load lighter and get that moving. Appreciate that. And also on the day of the legislative meeting, we're asking that all the members of the committee be involved, be active, and be helpful. If you're available to register, to help register, to get there early, to help register, contact Alyssa. They need some help at the table, getting people signed in and then moved to the right table, because there's some confusion when they come in. They've got their chapter number, but they have to go to a table for their legislative district. And so if we could get a few of you to volunteer to help with that, that would make that day easier. And then also asking that you be active that day and be aware of people at your table, that maybe it's their first day to do lobbying, share with them your experiences and how it works, and work with your the leader of your legislative district with a plan when you go over to meet with the legislator, so you know who's speaking, what the important issues are. And I really am going to count on all of you to be active in that. Appreciate all of you being on the committee, and like I said earlier, I assume by being on the committee, you've said you're interested in participating and want to help, and that's so important. Thank you. Okay, now we come to the work group updates, and our work groups have been very active. Warren, do you have an update for us?
Yes, I do. Emma provided a very good overview of where we are with the 2024 ad hoc COLA and with the reoccurring COLA. I'll just add a couple of comments onto his. There are 2 challenges that the Office of State Actuary is facing in coming up with any proposed options for reoccurring COLA. First, it must consider employer contribution and rate stability. And secondly, it has to coordinate with the elimination or reduction of unfunded liability. The employer contribution is a critical component of funding for the PERS and the TRS plans. They provide that stability when you have up and downs on return investments and when employees contribute less than 1% of the funding. So it's critical that they have that predictability and that stability. Plus, they also carry a lot of weight with the legislators. The unfunded liability, what the 5294 legislation did, excuse me, it provided a pathway, a glide path pathway approach to reaching 100% zero imbalance for the unfunded liability. That's critical for legislators. That's the one hurdle that we have to get through in order for them to buy off on this. So that's the challenges that they'll be facing this biennium as they work on options. I suspect we will probably get their proposals, I'm guessing around October of next year, as they get ready for the 2025 legislature. The other thing is we will be meeting, our pension policy work group will be meeting on December 15th, following the SCPP meeting next week. We'll be kind of wrapping up our 2023 accomplishments, and also planning for 2024. What will our objectives be? Coming up with kind of a preliminary meeting schedule for 2024. So overall, I think we've been fairly successful, as has been mentioned. I think we've gotten the attention of the SCPP and the legislators. I think we've gotten their respect. And so we move forward to 2024, and hopefully in 2025, we'll actually see some legislation.
Thank you, Warren, and thank you for all your work And I'd just like to mention the members of Warren's work group, Christine Craig, Debbie Lippincott, Gail Spaeth, and Linda Nielsen. And I know they've been working hard all year. I've been getting their reports and they've been following it. They're following along very closely, working hard. Thank you.
Mhm.
And Matt Goshan, if you have a report for us. You're muted, Matt.
My hitting the space bar trick didn't work this time. The primary thing I'd like to do today, after introducing folks, is presenting our annual report. And we've been busy. We have here various people who attend meetings or either on the committee or attend meetings regularly. And there's Amy from the Squim area. And there's Aruna from over in the Spokane area. Bill Ziegler attends from King County. We have, let's see, going down the list here, Ed, a fellow District 34 resident, and Elliot on the board, and Linnea from the east side, the east side of the lake, and Susan from the Tri-Cities. And yeah, and that's just at this meeting. So some of those that I mentioned are members of the Legislative Committee, but you can see there are also folks who attend these meetings who aren't on the Legislative Committee. They're attending here because they are interested in the topic and involved. And I can't tell you how grateful I am for their involvement. And our discussions, we have people, since healthcare is such a complicated arena on so many different levels. Oh, and how could I forget Claire, who attends? I'm sorry. Claire attends every meeting, and you know how busy a guy he is. And it's so nice to have an officer attend who can give us background on what's going on in the state and help us weave our way through the process. Very appreciative. But we have people with different skills and different interests, and we're working our way through trying to understand from a state and a federal level what's going on and what we can do. And we are asking today that our annual report that's in the packet be approved and then move its way up to the executive committee for final approval. I want to thank my wife, Kathleen, who said, "Hey, what about an annual report?" Oh, yeah. Thank you to Kathleen. And I approach development of these reports with a lot of anxiety because I'm not a quick writer and I don't have a linear brain. But my gosh, in one meeting, and I remember Amy, she just went, "What have we done?" "Well, we've done this and this and this and this and this and this and this." Wow. So it made it a lot easier. So I'll go over really quickly, not line by line, but what our group was assigned to do was to work on healthcare, affordable and comprehensive healthcare for all our members. And we quickly discovered that we have two different types of healthcare recipients in our organization, those in PEB and those not in PEB. And what we want to do is help both groups, but the group that we're most directly involved in helping are the people who get their healthcare through PEB. The other folks, they'll either get it through their employer or through their partner, or it's on a federal level, which as we have discussed today, it's pretty difficult to move things on a federal level. But PEB is right there, and we can go to PEB meetings, and Elliot's on the board, and we have the state office advocating for us in contacting HCA and PEB and actually getting answers from them, which is very, very helpful. So what I'm getting down to is it's teamwork between the health group and between Lori and Emmett and between other volunteers. I think we're actually moving the needle on a state level, and it's something that we can all be proud of. I feel like I'm in good hands, you know, with the state in talking with HCA and talking with the governor's office, that we're making progress. Some big things we did the last year very quickly. Maybe the most tangible one is that Sheba, the group of volunteers who help Medicare retirees choose health insurance, they, after years of not doing so, have agreed to help RPEC retirees and all PEB retirees get information on how to choose the best plan for them, because that's a very, very complex process. And so hooray, Tim Smolin with Sheba has just been a real peach. We are so fortunate to have a relationship with him. And we also created the little mini video seminars with Tim that went over the various different PEB plans, retiree plans. That was really helpful. We've also gone to multiple people on the work group have been active on Zoom with the PEB meetings. And we meet twice a month generally. So we're a very active group trying to learn. There's this wave of information coming at us that we try to process. I think I'll stop there, but that was just to give you a background of this annual report. We've been very active, and I'd like to ask the Legislative Committee if they would approve this.
I think there's no question that we will accept your report. I think it's amazing. Thank you for all the work. I'm not sure this is anything we need to vote on, but I'd like to ask the members if they would all agree to accept this report, and we will forward it on to the Executive Committee. Please raise your hand if you support us. And I think we will find it's unanimous for all of your hard work. We appreciate all of that. It's fascinating, the amount of work and effort you've put in. And I especially want to read item number 8 in your report. Pressured Healthcare Authority and PEB to be less secretive, more accountable, and more transparent. That's huge. That's just amazing. That was a goal we all thought we could never reach, and just appreciate all of your hard work. Thank you so much. We accept this report and we will forward it on to the Executive Committee. Thank you so much.
Yeah, we're a team. I'm very proud of that we're a team, and we're working our way forward through this with really committed members. Thanks to everyone. And thanks to the state office for their incredible work on working with the governor's office and HCA. It's just the support provided by that is just amazing.
And I think you and Warren both proved how important it was to how these work groups could work effectively and how powerful they were, and all the extra time that went into both of these two issues that are so important to RPEC members. Just can't thank you enough. You both just did amazing. Thank you so much. I see some hands going up for applause. And Elliot has her hand up.
I'm sorry, I got called away by our handyman. Okay, that comes first, I guess, sometimes. I don't know if this was raised, but what really helped me as a PEB member, I think the PEB member needs to be on the healthcare committee. Because there's stuff discussed in PEB meetings, and then in our healthcare committee, people do that work. And I'm like, what? You know all about this? And so it's been incredible. The other thing that this committee did, and maybe Matt touched on this, when I'm at PEB meetings, it's to the point where I'm just one little voice among, 5 others, and they gang up. But when our healthcare committee members show up and they ask questions, and so the reinforcement of the troops come in, and I'm not alone, and they start listening. And so it really was like, I'm outnumbered by the guns, and then the rest of the army comes in, and they save my butt. So but it's not just me, it's the issues finally get addressed, because I get run over. I'm outnumbered.
Thank you.
So I can't thank you enough. And if anyone else, has questions, please bring them up at PEB. I'm ignored. It's like I don't exist. So thank you.
Thank you, Elliot. Warren, did you have something you wanted to add?
Well, just to add on, Nancy did my job for me in thanking my committee members. We don't meet that often this year. We met quite a bit in 2022, which laid to kind of the groundwork for where we are now. And 2023 for us was somewhat of a quiet year compared to 2022. So we only met several times this year, although the committee members and myself, we communicate a lot by email that you don't hear about, you don't see. So we have pretty much ongoing communications, and just as was mentioned by Matt, we've also been honored and privileged to have Claire attend every one of our meetings that we have. So he gives us he's a good sounding board, because he can give us the overview of, okay, well, here's what RPEC's thinking and so forth. So, but really, when you think about it, whether it's the healthcare issue or whether it's the COLA issue, the thing that really provides us support is all the members.
Yeah.
And the members are critical in that communication with the legislature. That's who they hear from. And just as a side note, yesterday, the Attorney General came to our meeting, who's running for the governor. We had a little bit of exchange, and basically he was non-committal about COLA, reoccurring COLA. Basically, his answer was, I will give it some thought. Well, I'm open-minded to it, which is another way of saying, I'm not going to commit to anything until after 2024 election. And I said, well, when you become governor, the budget becomes your responsibility, and any legislative action becomes his responsibility. So we will see what happens.
Good. I appreciate you keeping his feet to the fire. Thank you so much. I appreciate you both mentioning Claire. I think we've got an important president who attends the meetings, and not only attends them, but he participates and he follows the issues and he follows up on things. I think that's made such a difference to our legislative committee. I really appreciate all of his time and effort. Sometimes he's in the background, you don't realize he's there, but he is there taking notes and contributing when needed. Thank you so much. Okay, and speaking of champions, Emma's going to give us a update on how we're doing with our awards that we voted to give to our legislative champions. Emmett?
Yeah, thank you so much, Nancy. So as far as I know, we have not had any changes since our last meeting. That is despite Carol doing everything humanly possible to try to get our award to Representative Stokesbury. So we are going to be doing some behind the scenes work to figure out what needs to be done to get him that award. I see Lori has her hand up, so I'm going to see what she has to say here, Lori.
Just we brought Carol spoke about the challenges that she's been having at our legislative call last week, and our lobbyist is now getting involved. And so she'll be getting back with us with what the path forward looks like. So thank you, Carol, for your tenacity, and we're awfully sorry that you've had to follow up so many times with Stokesbury, but we appreciate you keeping us in the loop. And when we continue to not gain progress, that's why we have a contracted person that can perhaps do things a little differently for us. So we'll keep you posted on that front. Thank you.
Thank you. So back to the agenda. The rest of this is just sort of reminders of where we are and what's going on. So I'd just like to remind you, members of the committee, to continue to make efforts to meet with your legislators and elected officials. That's really important. As you know, when you meet with them, if there's a name or recognition that they recognize somebody in their group that they've had another contact with, how important that is. It just sort of make sure they understand that we're involved in so many things and how important they are. So, and then we have the legislative committee meeting dates listed for you. This is in an effort to that, so that we don't have conflicts coming down the road. So you get these meetings on your calendar. They're so important. Under the good of the order, we'll be starting the updates calls beginning January 12th.